The 14 days between ovulation and an expected period are a window of near total invisibility. During this 2-week wait, detecting a pregnancy is notoriously difficult because standard home tests often can't see the hormones yet. The confusion stems from a biological overlap. The earliest indicators of a pregnancy look nearly identical to the body's standard premenstrual symptoms. Bloating, cramping, and fatigue occur in both scenarios, leaving no obvious way to distinguish one from the other. The female body is communicating physical changes through a specific vocabulary of symptoms. But because signs of a successful conception and an impending period share the same physical language, the message is easy to misread. A misread signal is a very significant risk. The stakes of this wait extend beyond a surprise pregnancy. The wrong interpretation can lead to an overlooked medical emergency. Accurately sorting these routine biological shifts from genuine red flags provides the specific information needed to identify a crisis before it escalates. This graph tracks basal body temperature. Typically, temperature rises after ovulation and falls sharply as menstruation begins. If fertilized, progesterone stays high, preventing the crash. If your BBT stays elevated past your expected period, it indicates a divergence from the norm. Roughly 6 to 12 days after fertilization, the developing embryo burrows deeply into the vascularized lining of the uterus. This microscopic disruption of the tissue can cause light spotting, often occurring just a few days before a period would normally arrive. This comparison chart highlights the physical differences between the two. Implantation bleeding is typically pink or brown, spotty, and lacks any tissue clotting. A standard period, by contrast, is crimson red and develops a progressively heavier flow. Assessing the specific timing, color, and texture of that bleeding is the most accurate way to separate a normal cycle from early implantation. Once implantation is successful, the body initiates a massive flood of HCG, estrogen, and progesterone hormones into the bloodstream. These hormones act as a systemic command, rushing through to reconfigure the body for pregnancy. This chemical surge is what triggers well-known symptoms like morning sickness, breast tenderness, and a sudden bone-deep fatigue. But the changes also impact less obvious systems. Total blood volume increases rapidly, forcing the kidneys to process extra fluid and leading to an immediate increase in the frequency of urination. These hormonal shifts also reconfigure how taste receptors function, leading to a phenomenon called dysgeusia. It's a sensory disruption that leaves a persistent metallic taste in the mouth, often described as if you were holding a handful of coins. While these sensory disruptions are intrusive and strange, they are harmless quirks of a rapidly shifting internal environment. Not every signal is benign. In an ectopic pregnancy, the fertilized egg implants outside the uterus, most often within the fallopian tube. This schematic reveals the mechanical danger. The uterus expands, but the fallopian tube is a rigid structure that will eventually rupture. The first warning is sharp, one-sided pelvic pain. If it ruptures, internal bleeding irritates the phrenic nerve, radiating pain to the shoulder tip. Identifying that specific combination of intensifying one-sided pain and shoulder discomfort is what allows for intervention before a rupture becomes fatal. Physical symptoms provide significant evidence of what is happening inside the body, but they are not definitive. For decades, medicine relied on interpreting these symptoms through observation alone, which left little room for certainty. If your BBT remains high or you notice unusual spotting, the next step is a home urine test. These tools provide confirmation by specifically identifying the HCG hormone, moving the diagnosis from a guess to a fact. However, if a positive result is paired with unilateral pelvic pain, fainting, or shoulder pain, you must follow an emergency protocol. These are the indicators of an ectopic pregnancy, requiring immediate surgical care. Correctly translating the body's early communications replaces the uncertainty of the 2-week wait with a specific plan of action. Understanding these signals allows you to take direct control over your health and your safety.